I'm Dr. Tara, and this is Hopeful Hints, a podcast where you'll receive quick, hopeful hints on all things women's health and infertility. Here, you will find education, inspiration, and most importantly, find peace and empowerment as you walk through the next steps in your healthcare journey. Welcome to Hopeful Hints. I'm your host, Dr. Tara, and we are on part 4, our final part of my 4-part series on my journey through endometriosis, adenomyosis, and excision surgery. So part 4, I want to share a little bit about recovery, post-surgery, some reflections, looking back, 7 months post-surgery, things I wish I would have known, or just some tips and tricks looking back. But just kind of validate what you've all been through. Because if you're at this point, you're probably considering surgery, you have surgery scheduled, or you already had surgery. And there's been a lot that's went into it financially, emotionally, mentally, physically. It's a lot. And I was not prepared for the recovery. So my first number 1 tip is take more time off than you think you need. I'm going to share something that I have seen with excision surgeon recommendations typically is 2 weeks off of work. And what I have seen in a non-excision surgeon say you can go back 2 days later. If you are told that your post-op care is 2 days, it's such a red flag because that's not true recovery for true excision surgery, nor is it okay to go back that soon. Let's talk about it. So what did the first 24 to 48 hours after surgery look like for me? What did the first 24 minutes look like for me? So I did not come out of anesthesia well. And some of you have probably had surgery already. And if you have, and you know that you don't recover well, you know that you commonly get ill. For me, I know that if I don't get Valium before surgery, I wake up screaming I can't breathe. I don't know what that is. I've never looked into it, but it's happened for my gallbladder, my bunion surgery. Yes, I've had bunion surgery. So I just know to tell them, hey, I need some IV champagne, as my doctor's office called it, before surgery. I will recover better. They maxed me out on recovery med. And I remember being in so much pain. And I wasn't ready for that. But my surgery was also supposed to be an hour long, and it was 3 hours long. And so I would also, that is something for it. You need to plan for once they get in there, what they're going to find and how that's going to dictate your recovery. So take more time off work, take 2 weeks minimum, take 3. It's easier to go back to work early than it is for you to not be doing well and then say, oh, by the way, I need more time off. Or you're in a position where you can't do that and you go back too soon. And what can happen when that occurs is not good. I walked. It was very slow. I tried to get up and move the best I could to get moving right away. It's really important for many reasons. But staying on top of your pain plan. So my doctor provided me, her staff and nurses provided me with what I had all received, what time I should be taking my next pain medications, and I had a pain plan. Don't try to be a hero, as my husband said in our recording together. I did. It's not that I tried to do that, but I became very stubborn with my pain medications until it was too late, and I was in tears, in crying out loud in so much pain. Please, please, please stay on top of your pain medication. Ice is another great minimally invasive pain remedy that you can use post-op. Just be icing all the time and have a pain plan. You need those pain meds. That's why they're prescribed to you. If you're an individual who doesn't handle pain medications appropriately, have that conversation with your surgeon before surgery. Create a pain plan before surgery is also another great thing. Nausea plan, constipation plan. You got to stay on top of constipation. I had a really large nodule of endo removed. And so a big thing that I also focused on was constipation tricks and hacks. Modifying my diet, making sure I wasn't eating things that were hard to process and metabolize, drinking lots of water. I had some teas that I drink to help keep things flowing, Miralax, aloe juice, castor oil, all tricks and things you can do to start right away post-operatively to really stay on top of constipation, because anesthesia in itself is going to cause that. I have on my notes here, I loved the underwear, like the medical underwear they came. I bled a lot post-operatively, which is another question. In fact, I just had a patient write me about this, like, how much bleeding should I expect? Should I expect to bleed afterwards? Yes, you should. Again, your surgeon's going to provide you with what's normal and abnormal for bleeding. I did get my period like 2 weeks later. So I went from post-op bleeding into my cycle. So plan for that. So it was longer recovery because of that too. That first cycle, that first 6 months of your period, if you're not having hysterectomy, you're still going to have a cycle, are going to be brutal. They're going to be up, down, turn around, painful, heavy, crazy, wild, really good, really bad. It's going to be a lot of just healing and hormone fluctuations going on. So really prepare for that. Use their fun underwear, bring pads with, they provide you with some, but just go with pads and be ready for the bleeding to happen as well. I did a lot of walking. I started physical therapy twice a week right after. So the week after surgery, when I arrived home, I started pelvic floor physical therapy right away. Please schedule those appointments before your surgery. Many pelvic floor physical therapists have a long wait list and they book out because they're really great at what they do. So please pre-schedule your physical therapy appointments. Again, 6 to 10 weeks of twice a week is ideal in my opinion. Then you can go once a week for a while. Know how many sessions your insurance is going to cover beforehand, because I might have got a little surprised at that, finding out that mine only covers 30 sessions. Another topic for another day. But I also brought with, when I talked about ice really helped me, I constantly had ice on my lower abdomen, my incision sites. I got one of those old school ice picks. I don't know how to explain them, but they're round and kind of twisty looking where you can like refill it with ice cubes. And at the airport, I'd go up to the bars and the bars would give me ice to fill it. So when I was flying, I just walked up to a restaurant or a bar and had them fill my ice for me. The thing that caught me off guard was in pre-op, Dr. Duke was like, you're going to be really emotional afterwards. I'm like, I'm not emotional. I'm not an emotional person. And he's like, you're about to be an emotional person. And he's like, it was funny. And I was like, oh. Well, anesthesia tends to do that, right? So anesthesia can cause some emotional fluctuations. But for about 2 to 3 weeks, if not longer, I was all over the place with my feelings, my emotions. I just want to normalize that. If you're crying in the shower at 10 p.m. like I was, this is normal. Work with your healthcare team. Have a post-op follow-up set with your trusted endometriosis care team once you get back home. A lot of our patients do that. They pre-schedule their physical therapy. They pre-schedule their post-op follow-up with us. My patients also know that we are their go-to place if there's any complications, and we work very closely with their surgeon to make sure that there's nothing that can't be relayed back to that surgeon that we can't step in and help to. So have your care team ready. Make sure you go to them. Don't try to tough things out. Again, there's no badge or award that you get at the end of this. I also want to talk about treating anxiety before. So if you're a patient of mine, you know I've openly shared that I tend to have a roller coaster. Like, I'm not scared to fly, that I'm scared to fly. But you also know from my first recording of this 4-part series, I had a lot of anxiety going into this. This is where I want to talk again and reiterate and validate. This is not an easy decision. We as humans are not like, oh, yay, surgery. I'm so excited. I'm going to be so calm during it. Nothing to be afraid of here. Like, just going to lay on this cold table and get put to sleep, and I just signed a whole waiver saying, I might die. Like, that is not a normal experience that is easy to walk into. So let alone the what ifs of what if I don't have endo? What if I get in there and they find nothing? Or, what if? So work with your healthcare team. I provide some PRN anxiety medications for my patients to travel with, and I recommend it to use PRN. I teach them how to take it appropriately and how to use it afterwards too. If we need to treat any mental health, anxiety, or depression,
we don't make any changes before surgery that could make that outcome worse on the other side. I have seen that happen where individuals just stop their depression and anxiety meds before surgery. And there's a lot of post-op complications that come with that. And then just, again, please don't be afraid to reach out to your healthcare team with any post-op mental health concerns, changes, emotional changes. There's things that can be implemented to help with that as well. I also like relaxation techniques, working with your team. I'm a huge proponent of having a whole healthcare team from acupuncture, physical therapist, spiritual, emotional, energy, all of that. Work with those individuals. I did a lot of that too, from body talk, Reiki, you name it, meditation, yoga. Work with your care team and utilize those therapies as well to help heal. Really just taking care of you, saying no to events, to things that fill your schedule. Take this time to heal. Please, please, please. How long it took for me to get around comfortably. So I remember vividly, in the first 2 weeks, I went for a walk with my husband way too soon, way too far. I started to spot and bleed. It is normal if you overdo it to spot and bleed for the first up to 6 weeks. It can be very common for this to happen. And so not overdoing it. If you're starting to have pain, stop. Literally stop walking and have someone come pick you up. Don't try to push it. Don't try to do it. You're not going to run back into your fitness routine. Really follow those restrictions and ease back into movement. I know that this is as I'm air quoting, laparoscopic procedure, but this is a major laparoscopic procedure. This is not a little thing. It doesn't matter how much they do or find in there. There's a lot of emotional and mental wellness that goes along with this in the recovery stage too. So please just give yourself grace if it takes you a little bit longer to get back into your fitness routine. It might just be walking for a while. Don't try to overdo it. You're going to get back into it eventually. Just really take it easy for those first few weeks. Getting out of bed. So we shared in one of the episodes too how hard it was for me to get into a hotel bed. And then how I rented an Airbnb that was super cute, but had a loft. So these are things you should set up at home too and really be aware of. Have a step stool. Have some things in place when you get home to make getting around your home and getting in and out of bed easier as well. And having your home set up appropriately. Don't have someone that's going to be with you right away. Make sure that your area and your space is set up with your medications and your water and some easy food and snacks so that when your caretaker's not around, you can easily get to them without having to do too much. Incision and wound care, if you have any concerns or situations that arise with that, please reach out to your provider. Don't let them fester. I've had to step in and provide some antibiotics to help take care of those in the first few weeks post-op as well. So don't be afraid to reach out as well. We want to look for signs of infection. If there's redness, irritation, burning, drainage, pain, fevers, chills, fatigue, you have to speak up and let's get you seen right away. Diet and nutrition and then foods to help with healing and digestion. I'm really a big anti-inflammatory person for this disease in general, but you're going to ease back into it. Your appetite might change due to anesthesia and surgery for a while, but the constipation piece can linger for a few weeks too. So really being aware of foods to help ease that up. High fiber foods, get your protein in for healing. And then staying on top of nausea as well. So my surgeon did prescribe Zofran beforehand. So really don't try to tough it out again. There's no badge for staying nauseous. Take those medications, stay on top of that. I did a lot of electrolytes for hydration as well. And then I'm going to dip back into managing the emotional toll and frustration. It's a lot. It's a lot to go through. Because so many of you have either been told you don't have this disease, you might have even had multiple laparoscopic procedures, and then you get to an excision surgeon and you find out how bad you've really been internally all of these years. Please establish a relationship with a mental health care provider, even if it's for one session. It's a lot to take in. There's a lot of feelings and past traumas that come up from that. You've been medically gaslit. You've been through so much already that it really flared for me for months. I'd be lying if I didn't say there's still times where those feelings are coming forward. I will say it's mostly due to my fertility journey because I'm back in it and I feel cheated. I feel like I've had years of my life and fertility opportunity drastically changed because of how long this took to get to. In fact, at time of recording, an hour ago, I just had an IVF consultation with my new reproductive endocrinologist, and I haven't fully soaked in what she all has said yet, and I'll share that on a different episode. But it's because of the delay in care that I received. It's because of the 8 to 9 to 10 years that my healthcare team overlooked this disease. And there's damage that's been done that's going to drastically change the direction that I go with this fertility journey. And my ability to conceive naturally is probably never there. It's never going to be there. So there's a lot of you who've had relationships that have been altered because of what you've been suffering through, job loss, just a lot of heavy stuff. So I just want to encourage you to please find a trusted mental health care provider and team support group. I'm here for you too. Like, it's hard to go through this afterward. Finding the right support through friends, family, online community, jobs that support you is so important too. And then I put this in here, but setting realistic expectations. Mine were completely unrealistic. To say the least, I was like, okay, I'll be fine after this, right? And I was not. I had to take 3-4 weeks off work. I wasn't myself for so long because of the amount of endometriosis that was found and the extent of my surgery. And again, I get asked, when am I going to feel normal again afterwards? And I've seen it very differently for some. In fact, my most recent patient shared with me that she feels better post-op than she did before. And she had a lot of scar tissue. And, it doesn't matter how much endo is found. Even stage 1 or, 1 lesion, 2 lesions can cause a lot of day-to-day pain, fatigue, GI issues, and a lot of that gets resolved. And I have seen a lot of my patients do so much better post-op than they were on a day-to-day basis before too. So there's always that. I want you to just know that progress is week by week, day by day, minute by minute. Don't try to rush it. Don't question it. Get your care team together, have your support team together, and don't be discouraged. I remember being very discouraged at how slow or how icky I felt because, again, I didn't realize what we were going to find when we went into that surgery, and I just wasn't prepared for it appropriately. So I'm always saying over prepare versus under prepare. Have your follow-up appointment questions ready. Have your spouse or significant other or your caretaker, your mom, your dad, your grandma, whoever that might be, have them have their questions all ready ahead of time too. Please have them record. Your surgeon should come out and give a summary of what was found, or if they are doing a phone call, please have them record that because you're going to be, high on pain meds and anesthesia and coming out of anesthesia, and they don't know what to ask. They don't know the words used. They don't know what was all said. So I find a lot of times my patients are like, I missed the call, or my caretaker told me this and it doesn't make sense. So really record that somehow. Please record that. And then you can use that to process and digest what just happened and create questions for your post-op. You should have a 2-week post-op, and a 4-week post-op is very common as well. So write those questions down and know that no question is silly, goofy, or off limits. Ask anything. And then what's next for managing care after excision surgery and after you've healed and after you've gone through recovery? So many of you at this point maybe are just finding out you have adenomyosis, for example, and there's a lot of unthought of cares. If you're told there's nothing that can be done for that or birth control is the only thing for that, fine. Find a team that understands and is open to some other options that are there to decrease inflammation and work on your symptom management. And really just know that you are in control of your healthcare team. You get to pick who's on it. And be ready to put boundaries in place. Again, too, your recovery is unique for you. And I want you to advocate for yourself moving forward. I know I say that a lot, but this is your opportunity to advocate for yourself. I want to talk about a hot topic before I close here. And that hot topic might be, what do you do if you have been told you had a previous surgery, laparoscopic, from someone who claims that they could treat endometriosis, and they told you didn't have any, they told you they got it all, and then you go to an excision specialist and you find a completely different story. They found lots of endo and then there's scar tissue and endomyosis, and you want to reach back out to your healthcare team that said, nope, nothing there, or we got it all, or you don't have endo. I do really encourage patients to move forward with writing that letter, contacting patient relations, and speaking out for yourself. That's part of advocating. You had wasted years of your life, years of your healthcare. You trusted them. They didn't refer you on. They told you there's nothing that can be done. Insert whatever statement you might have been told. I want you to know that it's okay to reach back out to those individuals and just do it in a very advocating, professional way and take steps. Journal it, write it down, sit with it for a while. Maybe it's just getting it out there on paper that's therapeutic for you too. Writing your story, writing your letter to that provider, to patient relations, and just getting it out there on paper, sitting with it and seeing where it goes. You've been through a lot at this point, and recovery is going to take you on a whole new journey. It's not going to just be surgery happen and that's it. Close the book, chapter done. There's a lot of recovery mentally, physically, emotionally, spiritually that goes along with that too. And for anyone listening that might be like, oh, you're being so dramatic right now. You clearly have not been through what 99.9% of patients have been through, the gaslighting. I just wish I knew about the grief feelings that were about to arise post-op, and the questions that I would have about how come nobody found this? Why did this take so long? How could these providers have missed this? And so you're not alone with that. Again, find your team, find your tribe, find the support systems and groups online. I'm here for you, a message away. Really hope you have found this 4-part series helpful. I'm a message away at all times if you're needing somebody to lean into. Again, if you're local, Simply You Wellness, we are all trained in this with advanced training. There's resources out there for you that really, truly specialize in learning and being up to date on endometriosis. You have to be up to date. And I do plan to put out, hopefully at the time of you listening to this, I have a survey. If you are uncertain if you have endometriosis, I have a really quick survey you can do that can help you determine, do I have it? Does it look like I have it? Could I have it? And we'll help you get set up with the next steps that are best for you. Surgery isn't right for everybody. It might be next month, next year, 10 years, 5 years from now. When you decide to make that move, just keep having open conversation with your healthcare team. Just do a consultation is usually what I tell my patients. Make that first step, do the consultation, and connect with others who have been through it to really help you through this recovery stage as well. Before we end this 4-part series, I want to thank you for listening, and I really hope you found it helpful in one way or another. One thing I'm going to include at the end of this is my travel list, so things to pack and things to bring with and prepare for your surgery to hopefully help you. I want you to have what I found to be helpful, what other patients have found to be helpful that have gone before us, and just make traveling for surgery easier. So make sure to check out the note for today's podcast, no matter what platform you're on. If you happen to not see it for some reason, please send me a message on Instagram at Dr. Tara Herding. I will get you that list to make travel easier for you, for your caretaker, and just things, again, that us who have gone before you have found helpful for travel. So make sure to download that list. Know that you're not alone in this journey. Thank you so much for listening this week and for listening to this 4-part series. We have so many great episodes coming in 2025, so make sure to hit subscribe, follow along, leave a review if you would like, and we are going to be breaking down some barriers in women's healthcare. For listening.